Do you suffer with pain and think that medication is the only way to manage it? Think again, because we're going to discuss pain and inflammation today on Chronology.
You're listening to Studio 809 Podcast. This is what community sounds like.
Welcome to the Functional Fitness and Nutrition Podcast with Chronology on Studio 809. I'm Stevie.
And I'm Will.
And we're your co-hosts and experts behind Chronology Functional Fitness and Nutrition. Chronology is a wellness company focusing on functional health and anti-aging through personal training, nutrition counseling, and a holistic approach to life. You can find us online at chronologyfit.com.
That's Chronology with a K.
So pain. We're going to talk about pain and inflammation today. I know a lot of people that I come across that are at least a good 10 years younger than me, and older people too, but it's funny to talk to people in their, late 30s, early 40s that just live with chronic pain all the time. And it's not from any specific diagnosed illness or, anything they can pinpoint. And they're just like, oh, well, maybe it's because I'm getting older, or I just have this problem and I'm going to have to take medication for it or deal with it. Or there's some people who have a diagnosed illness or some kind of, identifiable reason that they're in pain, but the pain's worse than it needs to be. And a lot of people do not realize that your lifestyle and what you eat, and if you exercise or not, all affects pain. So, for example, if you have a headache and you go to your medicine cabinet and you take something for the headache and the headache goes away, that's great. But what was the reason for the headache?
Well, I can give you an example of why I get headaches. I don't get headaches like talking about it because I eat very well and I don't eat like crap food and I don't drink, so I don't get really headaches. But when I do, they're from when I worked my traps the day before. So instead of me taking a bunch of pills, I usually use a massager or something or some heat
to go to the source of what's causing the headache.
It'll get rid of my headache before I have to take anything.
Yeah. Yeah. And there's other, things like food intolerances are a big one. People who suffer with chronic migraines, that could be one of the reasons for
I'm sure of it. I used to get them all the time when I used to eat like crap. Mm-hmm. I used to get them like 6, 8, 10 times a year, like bad ones to where you're down for a couple of days kind of deal.
And what did you do for those to get rid of them so that they don't come back anymore?
Well, at the time they would just give you like heavy pain medicine. But now I eat well.
And you don't get them anymore, do you?
Exercise. I don't ever have any more. I can't remember the last time I had a migraine.
Yeah.
Yep.
So it's a good idea if you have chronic pain of any kind, whether it's, migraines, arthritis, or anything like that, to try some natural methods of dealing with the pain or to see if it'll go away or get better before you run off to, get all kinds of medical intervention. Now, if you do things to rule stuff out, to see if things get better, and they don't, then absolutely go and see your medical professional. Or doing these things to kind of manage the pain on your own and working with a medical professional can complement each other. They can work hand in hand. So I'm not saying don't get medication or don't talk to a doctor. But there's a lot of times that it's really not something that you need medical attention for. For example, I have an old knee injury. About 25 years old, and for years it hasn't bothered me unless I eat gluten or sugar. Then I get like an autoimmune thing going on. I guess my body doesn't like it, so the stuff that's already compromised, the old injury, or sometimes I might get arthritis in my hands because I use my hands a lot when I do massage. My body doesn't like the offending thing that I put in it, and so it goes nuts, and so it attacks me, and I get pain.
It attacks, the vulnerable spots.
The vulnerable spots. Mm-hmm. And so like arthritis, a lot of times people will have pain, or fibromyalgia. Fibromyalgia syndrome. Syndrome usually means
they don't... your whole body hurts?
Yeah. The word syndrome usually means they don't know what the heck it is, and they just stuck a name on it.
So it's just like your whole body pains.
Yeah. Kind of aches to the touch sometimes with people. And I have found that a lot of people I've come across, and I'm not saying this for every case, but a lot of people I've come across have been intolerant to nightshades.
Yeah.
And that's why they have that chronic pain all over. Or stress can cause chronic pain all over. We think of stress as, that's a mental thing, but it does manifest as a physical symptom. It does cause pain. So if you're very stressed, very depressed or something like that, and you have chronic all over pain, it could be because of that.
Well, yeah. And if you put anything that's not supposed to be in your body, if you consume a high amount, it's going to come out as pain in some way. Just like what happens when you drink too much alcohol?
You get a hangover?
You get pains. You do.
Yeah. Because it's poison. Yeah. Or like in the case of gout can be very painful.
Yes.
And it's usually because you have a buildup of too much uric acid, which means there's something that you ate. The most common foods would be like liver, organ meats,
like
alcohol.
Little Bobby did.
And there's certain foods that cause
Chicken
a buildup
livers.
of uric acid. So if you eat a lot of them,
A lot of the deli
that's
foods.
why your foot hurts now, or wherever.
A lot of the deli foods where I'm from.
Yeah, from New York.
Those are bad for you. Yeah.
In large quantities, yes.
Liver
Well,
worst.
and I mentioned nightshades too, and that's not to say that some people can't ever eat them again. Sometimes it's a build-up kind of thing, just like uric acid with gout. It's like you clean them out. You stop eating them for a while, and your pain goes away, and then you might be able to tolerate up to a certain level. Everybody's different. You just got to find out what that is for you.
Right.
But if you have a build-up of the toxin that is in these nightshades, and for those of you who don't know, so nightshades are certain vegetables that, it's like potatoes and eggplant and tomatoes and peppers and a few other things that, so like animals have a self-defense mechanism to keep other animals from eating them. Plants do too. And nightshade vegetables have a particular toxin, and some people are very sensitive to it. Some people are not. Some people are sensitive in large quantities, and it can cause that overall pain. As I mentioned, arthritis. If you're ingesting something that your body doesn't like, it can cause arthritis. It can cause your immune system to go crazy and attack your joints. And if you notice, when you get a medication for arthritis, they usually say on the commercial, they ask you about TB. If you've ever had tuberculosis or risk for tuberculosis, may increase your risk of getting infections. That's because these things are immunosuppressants and they suppress your immune system.
Right.
So that when you eat the offending food, your immune system's more like, and it doesn't attack your joints.
Yeah.
Wouldn't it be better to just find out what it is that's making your body go crazy than to just take take a medication that's going to now you're going to catch all these other germs too?
Yeah. Remember when I was in culinary school and I had a classmate who made the statement that he couldn't eat corn because it would aggravate his arthritis. And I chuckled like, it's corn. But now I could see if he's intolerant to corn or, the outer shell of corn or whatever it is.
Or the particular kind of corn in America that's,
it was
made by a particular company with particular chemicals.
It makes sense now.
That's what he could have been intolerant to.
All these years later, it makes sense now.
Yeah.
That's why he couldn't have it.
Yeah.
Because it would actually cause him pain.
Yeah. So even if you have pain, like I mentioned, I have a knee injury. So yeah, sometimes it hurts just because it's an injury, depending on what I've done. But don't discredit that these other things could be making the pain worse. I'm not saying that if you try to figure out, okay, is there something I'm breathing, eating, drinking, touching that's causing this, because like skin, sometimes you get, you change your laundry detergent and all of a sudden you've got, a rash on your skin. It makes sense this could happen on the inside too, that you could have these, intolerances to things in your life. Try it out and see if your pain gets better. It might not go away completely, but it could get better. So food intolerances or environmental toxins that you might be getting exposed to mental stuff going on like stress and depression that can cause pain. And then
or technical stuff like I talked about, like if you're over exerting yourself, or you've worked out just recently and now all of a sudden, your arm hurts, or, your elbow hurts, something, you need to think, well, maybe I worked too hard in the gym. Something like that.
That's the next thing I was going to bring up. Not only working out too much, but not moving enough.
Well, that definitely will cause pain.
Yeah, a lot of people think, oh, I hurt, so I'm not going to exercise. But not moving actually causes you more pain, especially in, if the pain is caused by something else, like an injury or an illness.
Yeah.
It's going to add to it. It's going to make it worse. If you don't have any, pain from any other thing, you can still get pain from not moving.
Oh yeah, definitely.
From not exercising.
Like it's just
you actually get more tired sitting all day than exercising.
That's what stiffness is.
Mm-hmm.
It's if your joints stay in one spot for too long, things that are okay. Everything in your body is in like a flow.
Yeah.
Not just your blood, everything is just in a flow. So you sit too long, or if you're in bed too long, blood can pool, quote, they say blood can pool. The same thing could happen with this. Your joints don't move. Things are going to start collecting in the little bends and in the little corners and the little, the nooks and crannies of your joints, and you're going to be in pain.
Yeah. Or, when you do have to pick something up, you haven't used your muscles. So, it's going to be very painful. Yeah. I mean, that's why, like, after you have surgery or something, the nurse comes and gets you up.
Yeah.
You're like, well, I just had surgery. I need to rest. No, you need to get up and move. Or if you have an injury, say you sprain your ankle or you hurt your elbow or something, yes, you're supposed to rest it, but you're still supposed to move it every now and then. You're supposed to do range of motion. You're supposed to get that. It helps get the blood flowing to the injury. And it helps, it just helps with the healing. If you're just stiff and still all the time and you don't exercise, you take the elevator up one flight of stairs, you park as close to the door as possible, and you hardly move, you're going to be more susceptible to overall body pain. You just are.
You're going to be in pain. That's it.
Yeah. And if you already have, something painful, it's going to get worse.
Yep.
And then I want to talk about inflammation, because inflammation is another big source of pain.
Inflammation.
So like, okay, you sprain your ankle. It gets warm to the touch. It might get red, or any kind of injury. That's localized inflammation. We know about that. Imagine that warmth and that heat, that redness all throughout the inside of your body. That's chronic inflammation. Basically, you're on fire on the inside.
Mm-hmm.
So whereas just your ankle is warm because, blood's going there and it's trying to heal, your whole body is like, I got to heal. I'm something's not right here.
Yep.
And that chronic inflammation causes pain as well. You just don't feel good. You're just always hurting or tired or just bleh.
Then you get into the vicious little kind of cycle, because now you're in pain, so you don't move.
Which makes you in more pain. Yeah.
Then you start eating crap because now you're depressed.
Yeah, which makes you more depressed, right? Yeah, absolutely. So getting rid of inflammation, whether it's localized in the case of, your joints, or all over, you just feel like crap all the time. That is another way. Making sure that you are not inflamed is another way to deal with pain. Because if you're inflamed, the pain's going to be worse. So how do you do it? Well, of course you got to eat right. There's a lot of foods like sugar and alcohol and processed junk that is just going to make it worse. Too much meat can make it worse, can make you inflamed. Lack of fruits and vegetables and lack of water can make you inflamed.
Definitely lack of water.
Yeah. So you really need to pay attention to your diet. I'm not saying that you can't have occasional treats and that you have to watch everything, but overall, having a healthy diet, and including things like turmeric and ginger, those are very anti-inflammatory. Again, lots of fruits and vegetables, lots of water. And then there's some things you can take turmeric and ginger in a supplement if those aren't foods that you eat a lot of, and they're very anti-inflammatory. They might not work as fast as popping some over-the-counter painkillers, but if it's something that you do on a consistent basis, it does work. It will get inflammation down. It will help with pain.
You have to be consistent.
Yeah, you have to be consistent with anything, really.
Yep.
And then, so that helps with overall inflammation and overall pain and joint pain and things like that. If you're older, you might need to take like glucosamine and chondroitin. That's not necessarily anti-inflammatory, but it can help with things like arthritis. But then like muscle pain, if you've been having a lot of muscle pain, especially if it's from working out, but if it could be from anything that's muscle pain. Tart cherry juice actually
there's a difference, and you could tell from like a good workout, delayed onset muscle soreness, or you kind of pulled something, or you really injured something, or pain from you haven't really moved a lot. Those are all different kind of pains that you can feel in your muscles.
But I know the tart cherry juice helps heal muscles.
Yeah.
So depending on why the muscle hurts, that could be something that
definitely
helps as well. And then, of course, there's things like Epsom salt baths can relieve pain.
Yep.
Deep breathing, because you're getting oxygen and you're activating your parasympathetic nervous system, especially for pain in the case of stress, mental stress. If you're having physical pain, sometimes deep breathing can help with all kinds of pain, I think. I mean, look at Lamaze classes, for moms who are having babies, and then they focus on breathing. So deep breathing, do some breathing exercises, make it a habit every day. But then also, like if you're in, the midst of a bad headache and you're waiting for that over the counter to work, do some deep breathing.
Yeah, you could help it along a little bit.
Yeah, help it along a little bit. So caffeine and sugar are drugs, and sometimes you get headaches or pains because you haven't had any caffeine or sugar in a specified amount of time, and your body's like, okay, where's my drug?
Caffeine is technically a painkiller. They used to use it. It's a painkiller aid. Mm-hmm. So it helps, like, say, aspirin or something else.
Because it's a drug.
Yeah,
but if you're somebody who consumes a lot of caffeine all the time, and then
of course,
one morning you don't get your you're going to get a bad headache.
It's what us old ex addicts call having the DTs, but you don't really consider that having the DTs because it's just caffeine
or sugar. It's just sugar.
It's just caffeine, but it's exactly what a person who's using heavy drugs goes through, except yours is kind of localized in your head, and you can feel it up there. And whereas other people might have it, their whole body hurts. But yeah, it's the same thing.
Yeah. So if, you have some pain, especially if it's a headache, and you stop and think, okay, could I need caffeine? Maybe you have a cup of green tea or something and see if that helps your headache. And then reevaluate how much caffeine you have in your life, because maybe it's a little too much, and, you don't want to get into a situation like that. So, yeah, I think that there's lots of ways that you can deal with pain. I don't think that you should accept it, but I also don't think that we need to medicate for everything.
Exercise regularly. I'm telling you.
Exercise regularly.
If the more you move, I'm not saying you're not going to have pains, but the more you move, when you do get pains, they won't last as long. They won't be as extreme. You'll be more resilient to deal with stuff. Most definitely. I talked to a friend of mine last night who has had a little medical issue for the last couple of months, and it did involve some pain. And she said to me, I hate to think if I wasn't as healthy as I am, what I would have just went through, how much worse it would have been. Yeah. So even if it doesn't involve pain, I had her say that, and then I've had other people say, yeah, after I have my first stroke, I'll get healthy. So two totally opposite ends of the spectrum there. Yep. This person's grateful she was healthy before she got sick. Yep. So that she recovered quicker and it wasn't as bad. This person over here is waiting until
they're in dire straits
But
before they
until
do
they can't
anything.
speak, and then they're going to
and then like, oh well, I don't want to die, so I guess I'll do something now. But how do you know you're going to survive it, or survive it and be able to do things to get healthy? Now I'm far more afraid of living sick than I am of dying.
Mm-hmm.
So don't wait. Don't say, okay, this isn't that bad, I'm going to deal with it or whatever. I'm just going to let it go. You never know what's going to happen.
That's
and
the ones
to
that
be
get away
resilient,
from you.
yeah, to be resilient, to be already kind of in a state of healthiness before something happens.
Yep.
Because stuff's going to happen.
Yeah, because we're not 100%.
Right. But then you better be able to deal with it and heal from it and recover. Yep. And so, yeah, I think that if you can do things through exercise and diet and deep breathing and stress management and supplements to manage pain, find out why do you have the pain.
Try to find the source.
Find the source. Deal with the source. While you're waiting for the pain to subside because you've dealt with the source, do some of these other things. I think that you'll find that you have to take less medication. Mm-hmm. You can be happier and healthier. And again, there are times when medication's indicated. There are times when you need medical intervention.
Yes, there's most.
But give it a try.
If you're in like extreme, this is not for like extreme.
Oh yeah, if you throw your back out, yeah, you need to go to the doctor.
This is not for like you're crying in pain.
No, this isn't for acute trauma.
I'm not going to go shh. Take deep breaths. Stop crying. Take deep breaths.
This isn't for acute trauma. This is for chronic, low level, aggravates the hell out of me, but I still got to get through my day kind of pain is what I'm referring to.
Put pressure on the bleeding, but just breathe heavy. Deep.
Yeah, no. That is not what I'm talking about. I'm talking about your knee aches or you got a little arthritis.
The pain we all get every day.
I just ache all over. The achy kind of pain.
Yeah. A lot of times it's just from living. If you're like a really busy person too, and you don't realize how much you do during the day, you put a lot of wear and tear in your body.
Oh, and you know what else? Eye strain. We all work at computers. Yep. You can get headaches from eye strain.
Yep.
Instead of keep popping painkillers, check your glasses, check the lighting, see if, there's something you can adjust to do something about that. Because, since I'm, trying to tell everybody not to just rely on painkillers, let's talk for a little bit about the risks of taking painkillers, over a long period of time. Well, I don't need to talk about opioids. We all know about
Everybody knows that.
But let's talk about over the counter. So like ibuprofen, for example.
Can mess with your tummy.
It can mess with your stomach big time. You can get ulcers.
Yep.
It's just not good to chronically take that all the time. That's why it's better to use some of those more natural anti-inflammatories like the turmeric.
Right. Acetaminophen
could
damage your liver.
So, if you take a lot of that, and then if you do other things, like if you're on prescription medications and you drink alcohol and you take a lot of Tylenol, you're really giving your liver a hard time. So you don't want to take Tylenol. I mean, acetaminophen over and over again chronically all the time.
Right.
Because then that's bad for your liver.
That's why if you get prescribed a narcotic pain medication, they tell you don't take any
Tylenol
acetaminophen because it's already in it.
Yeah.
And then you'll be taking twice as much and it'll be hard on your liver.
Yeah.
Yep.
So these things have their place, but again, try to do these other things so that you're not relying on them.
Yep.
I'd much rather find out why something's hurting or not right and fix that than to just cover up the symptoms. And then it could be that it is a more serious problem that just gets bigger and bigger and bigger and bigger because you didn't find the reason for it.
Yeah.
You just kept masking those symptoms until eventually whatever you're using to mask those symptoms isn't working anymore. And it's a much more serious problem. It's kind of like, I always have to talk about cars. This especially gets guys to listen. I don't know why. But let's say your check engine light's on, but your car's running fine. I'm not too worried about it. And then it starts making a little noise or whatever, but it's running fine. Yeah, I'm not too worried about it. I'll just, I'll mask the symptom by cranking the radio up so I don't hear the noise or whatever.
Too worried about it.
And then eventually your car breaks down and now it's going to cost you $3,000, $4,000, $5,000 to fix it because you ignored the little $50 fix.
Yep.
Same thing with the human body.
Except we don't have a check engine light.
Right.
So
no, but you get symptoms. You get headaches and pains and
Wouldn't that be
aches
cool? You have like a check engine thing. You go, shit. Let me see what's wrong.
That would be. Too bad we don't have that,
Check
right?
your blood level. Blood level's a little low.
So yeah, just bottom line, if you have pain or inflammation, chronic achiness, and things like that, you need to eat right. You need to move. You need to find out why you have the pain and address that. You might be intolerant to something that you're eating, breathing, touching.
Yep.
Your environment, the lighting, the eye strain, your pillow could be messed up, and that could be why you're having chronic. Find the reason for the pain.
Your coworker could be the reason for your headaches.
Absolutely, you might need to.
So you might need to make
an adjustment
from your cubicle.
Yeah, don't just take over-the-counter pain medicine over and over again without finding why you have the pain.
Yeah,
and move. Prevent pain for no reason by
that move.
Not loading in junk food, not exercising, or not moving. What did I say? Not too many times.
Not moving.
You know what I'm trying to say.
That means to move.
Don't not move.
Do not move more than not.
And make sure that
move not.
Before you move, make sure that you warm up and cool down. That's very important when you're exercising.
People like to skip the warm up, especially in the cool down. The cool down, I know I've already spoken about this, but to really quick again, because it's really important. While you're doing this high intense exercise, say your heart rate is I don't know, let's just throw a number 138. The moment you stop for about 10 seconds, it's going to shoot up about 10 points, and then it's going to come back down really slowly. It's important that you take it easy and bring yourself down, or else you could pass out.
Yeah. And then knock your head on the weight bench, and then you're going to have some pain. But warming up,
breathe through.
Warming up's very important too. Yep. I can't tell you how many people in my years of doing massage, especially guys, would come in and, I had injured myself, so I didn't go to the gym for 6 months, and then I went the other day, and now I'm hurt. Can you fix my back? And my first question is, did you warm up? Nope.
Yep.
So you didn't exercise for 6 months. You went with cold muscles to the gym and started picking up weights. No wonder you're on my table with a hurt back.
Yeah.
So that would be more like pain prevention, I think. Yeah.
Yeah.
But, it all boils down to there's things you can do about chronic, low-level achiness and pain to get rid of it without having to rely on taking a bunch of over-the-counter medications and dealing with it. Need some more tips or ideas? You feel free, go to our website, chronologyfit.com. I think that's going to be it for us today.
All right.
Send us questions and topics you want to learn about. Subscribe to our website. If you would like some help, shoot us an email at contactus@chronologyfit.com or message us on Facebook.
We have some workout videos coming soon.
Yeah. And you can check out other great podcasts by visiting studio809radio.com. We hope you have a healthy, pain-free week. And tune in next time to the Functional Fitness and Nutrition Podcast with Chronology.